country as diverse and vibrant as India, the path to progress comes with its own challenges. The India at 100 series aimed to bring forth the challenges that our society faces even today, that of undernutrition, especially faced by two pillars of our future, pregnant women and children under the age of 5 years. Presented by DCM Shriram Foundation with knowledge partner the Indian School of Development Management, the show will explore the key issues as well as give solutions. So let's take a look.
In India, more than 220 million people battle with undernutrition. Despite progress, malnutrition remains a grave concern, particularly for women and children. Proper nutrition during pregnancy and for children under 5 is pivotal, shaping both their immediate health and long-term potential. Alarming statistics from NFHS 5 reveal that 1 in 3 Indian children is stunted, 1 in 5 is wasted, and the nation shoulders 40% of global low birth weight cases and a third of stunted children worldwide. Shockingly, 68% of under 5 deaths in India stem from maternal and child malnutrition. Let's understand from the experts on why there is an urgent need to actively tackle this issue.
Hello everyone, I'm Ravi Sridharan, co-founder of the Indian School of Development Management. Today on this episode of India at 100, we have an important subject at hand, undernutrition in women and children. This is something that's hindering the growth of this nation. Joining us today is Sunish Johri. Sunish is the president of Vitamin Angels and the chair of the executive group India chapter Catalyst 2030. Vitamin Angels in India is driving impactful change and is making a difference in the health and well-being of citizens. Sunish, we said that this is a problem that's hindering the growth of the nation. Could you sort of explain to us why is this such a serious issue?
I think we're still a nation which is struggling with the levels of stunting, wasting, and levels of anemia, especially in young children and pregnant women. Just to give you a sense, 1 in 3 children in India is still severely stunted, 1 in 5 is wasted, and you still have about 67% of Indian children under 5 severely anemic. We also have 1 in 2 women of reproductive age group as severely anemic. That has an impact on the first 1,000 days of life, as you know, and which obviously has multiple rippling effects as we grow and go as economy, because you're impacting or adversely impacting the economically mobile population.
Could you help us understand what all types or what all fronts the work needs to happen to address this issue?
We need to provide nutrition interventions, evidence-based nutrition interventions to every household, no matter where they live or what part of the society they belong to. Actually, an enviable architecture of public health ecosystem in India. It was actually at display during the COVID period. So we've all seen how we benefited from it in certain ways. But I think what is currently questionable and what we are seeing as lack of effectiveness is the quality of that system. For example, the quality of understanding and training capacity of last mile workers, right? Frontline workers as we call them. Organizations are now looking at how do you build nutrition literacy, almost do the same as we did with education, right? We're talking about prevention of a large problem. So if you're looking at nutrition as an area where every household should have certain understanding of what impact nutrition has for a young child, then that literacy needs to happen, right? Or every parent must aspire for the right complementary feeding or early feeding for the child. And that literacy has some room to go.
Whenever we take any issue, there are these, impact on other aspects or the impact of other things on, this work that you're doing. Could you help us understand what might be some intersectionalities that are very important in your work?
Sure. See, often I understand this as one of the foundational issues, right? So, a good way to understand this is if you pick up 2 or 3 largest issues that we are facing, social development issues outside of nutrition. Often it will have a connect both as a cause or an effect of nutrition. The other intersectionality is with gender, and you would have seen that the household level, often nutrition is a subject better dealt by a mother, right? It's nutrition of a baby is akin to mother and mother's choices and decisions. But when it comes to making decisions about outside of the household, whether it's to do with markets, buying something for the house to eat, or for example going to a particular doctor or a clinic, that decision is made by a man, right? And it's a function of who's more mobile or going out of house. And so we have these nuances which are very gendered and often have very deep impact on the nutrition of a child.
Suresh, this is a series called India at 100, and the intention is to understand what are the many different things that need to happen for India to be a vibrant, happy and healthy country in 2047. Looking at it from your perspective, what would your vision be for India at 100?
A good goal for us to have when India hits 100 is every child, especially under 5, has access to essential nutrients, micronutrients, nutritional care, no matter where they live or which part of society they belong to. The other way of looking at it is also from market equity viewpoint, right? We've all seen that post-COVID, there are plethora of products available in pharmacies which are immunity building products, but often tend to be highly priced, only affordable to a certain segment of the society. Now, COVID was not a lifestyle disease, right? It happened to everyone. So there has to be market equity where products, services are available at different price points for every part of the society as long as they can pay.
Thank you, Sunish, for joining us today. The following video would be a glimpse of the remarkable work happening on ground.
Maternal and child undernutrition carries serious consequences, with a staggering 68% of under 5 deaths linked to malnutrition-related health issues. Amidst these challenges, organizations like Vitamin Angels are working in partnership with non-profit partners and state and UT governments to navigate complex terrains and deliver essential supplements in remote areas. By ensuring timely vitamin A supplementation, VAS, VAS and deworming, they fortify children against infection, reducing risks of morbidity and mortality.
आमच्या इथे गावामध्ये तर डॉक्टर नाही आहेत कुणी, जावं म्हणजे परळीला किंवा सातारला जावं लागतं. आणखीन पाऊस वगैरे असला की खूप अडचण येतात आम्हाला, कारण इथे धरण असल्यामुळे पाण्यातून पलीकडे जाणं बी शक्य होत नाही. म्हणजे आणखीन डोस वगैरे बाळाला द्यायचं म्हणलं तर महिन्यातून 2 वेळा इथं सिस्टर येतात खालच्या, पुन्हा 6 महिन्यातून डॉक्टर पण येतात खालून सातारवरनं, ते बाळाला वगैरे बघून चेक करून जातात.
Partnerships with UNICEF are sparking a symphony of awareness and change. From illuminating the significance of Nutrition Month to conducting exploratory studies, they strive to strengthen nutrition interventions for mothers and young children, aiming for a healthier tomorrow. In a resounding act of unity, diverse stakeholders unite under the banner of the India Nutrition Collaborative. Their joint efforts target nutritional inequities, drive nutrition education and awareness, and catalyze change at the grassroots level. With a shared goal of addressing stunting, wasting and anemia, this collaboration charts a course towards a nourished and thriving India.
विटॅमिन ए आमच्या अंगणवाडीत आल्यानंतर आम्ही काय करतो, प्रथम मुलांची यादी तयार करतो. सर्व लाभार्थी अंगणवाडीमध्ये उपस्थित होतात. तर 9 महिन्याच्या पुढे ते 5 वर्षापर्यंतच्या मुलांसाठी विटॅमिन ए असतं.
A key insight from this episode and the approach to work in nutrition is that planning and decision making must be driven with equity at the heart, where we keep every last child in mind. This can also be inferred from Sunish's emphasis on nutritional equity and market equity in his work.